Lesson 5.4 is on how does technology keep people healthy. We're going to take a look at this lesson. This is the last lesson of this chapter, and it is shorter in content, but it may look like a longer lesson because we just have a lot of pages of pictures. The objectives are simple. You'll be able to describe the value of screening tests and also be able to analyze the effects of technology on personal and family health. Number 1, knowledge is power. It is very important that you can find out about different diseases early on because the sooner it is detected, the better chance of recovery you're going to have. And it applies for any range of diseases that you may encounter. Oftentimes, when you go to the hospital for different types of health tests, and it may not apply to you guys yet because you're still young, but for people like adults, they may have different screen tests. We're going to look into 4 different screen tests that people usually have, and the first one is going to be blood analysis. Most oftentimes, they check for your cholesterol levels because having bad cholesterol means you have a higher chance of having clogged vessels. They also check for insulin levels for diabetes. They also will check for liver and kidney functions to see if they are filtering your blood well. And for men, you may have prostate cancer. So oftentimes, if you're older, they may check for that. And also, if you request sometimes, they may do HIV or STD tests. It may not be part of the blood analysis unless you request them separately. The next one is going to be blood pressure. So you may have had an experience measuring your blood pressure either at a hospital or maybe at a clinic or health fair, and they check 2 things. First is going to be the systolic, and the second is going to be the diastolic numbers. So basically, systolic means how much pressure your heart is putting upon your body when the blood is coming out of your heart. Diastolic is going to be the pressure when the blood is going back into your heart after traveling across your body. And these numbers are important because it may be an indication of cardiovascular diseases. And if you have high blood pressure, the chance of having different types of cardiovascular diseases will increase. As an adult, the normal range of your blood pressure is 90/60 to 120/80. You will notice that the first number, the systolic number, is going to be always higher than the diastolic number because obviously when you're pushing blood out of your heart, it's going to be a heavier pressure, or it's going to force more energy upon it rather than the blood that would travel all around your body and then coming back in. Naturally, if you are female or if you're younger, your blood pressure is going to be on the lower range, and it's okay to have the lower blood pressure as long as your heart is functioning well for your size of your body. Another type of test is going to be colonoscopy, and basically what they do is after you drink some fluids to clean out your colon, they're going to insert a camera into the colon to look signs of cancer or other formation that you may have inside of your intestine. So if you see on the picture here, normal colon will have nice clear walls that's not going to have anything forming there. But if you have problems with polyps or tumors, things like that, you're going to see that in the camera. So what they do is they insert a little hook if they need to at the end of those tubes, and they basically cut this part that dangles from the wall of the colon and just cut them off. And you can remove them easily nowadays. You don't have to open up your stomach to get those tumor or colon polyps out of your body if it's removable. It's helpful to find different types of inflammation, bleeding, ulcers, polyps, tumors, many different complications that you may have inside of your stomach. The last one is going to be bone density check. So this is another one that you probably won't have it until later on in your life. But basically what they do is they measure the density of your bone matter, which is going to be how compact your inside of your bone is going to be. And if you're older, it'll be helpful to identify if you have osteoporosis. So think of your bone as a spongy material, or it looks like a spongy material, but it's not. So it's going to have a lot of small holes and structures that hold your body weight. Now, how you calculate the bone density would be how many grams of calcium and bone minerals are inside of a segment of bone that they're going to see. To check the bone density, they're going to use x-rays. And we know that females tend to lose more bone mass as they get older due to menopause. So these are just pictures to tell you how it looks like if you have healthy bone versus osteoporosis. If you have those condition, you're going to have larger and more spacious bone density, and thus it's easier for your bones to break upon small impact. And the graph on the right shows you that females are going to lose more bone densities after their menopause. So around 50s and 60s, you're going to see that there's a sudden decrease of bone density, and that's why it's important for older females to exercise regularly to increase their bone strength. Now, number 2 is specialized test. Based on the result of the screen tests that you have, you may or may not need these specialized tests. So if everything is coming out as normal, you probably won't need to take more tests. But if the doctor says, I think we need to check a little more in detail just to make sure that you don't have any health complications. Our first item is mammogram, and this is only for females. This is a special x-ray for soft tissue to see if you can find any tiny tumors. It is recommended for individuals who are older than the age of 40 to get it checked once every year or every other year, especially if you have a family history of breast cancer. So this is used for checking breast cancer. And here are some examples of the mammograms. So the left one we have the 2D one, the right one we have the 3D ones. And you can see the tumor clearly from the right one, which uses the 3D mammography. We probably have heard of ultrasound testing more frequently, and basically you're using high frequency sound waves and create the image of tissues, and it's going to be useful to get a clear picture of a cyst or a tumor inside of your body. Or other times it can be used to monitor complications during pregnancy and also for thyroid tumor. So it's going to be used for multiple different things. Nowadays they have different devices that helps you to check different body parts using portable ultrasound machines. Another familiar picture again using ultrasound. When you are having regular checkups, they're going to use the ultrasound to see if your baby's doing well. The next item that we're going to look into is going to be CT scan or CAT scan. In the hospital, they're going to use CT scan more often, but I'm going to give you CAT scan just so that you know the abbreviation. This is a special X-ray technique that people use in the hospital that produce detailed cross sections of the body parts. So unlike x-rays where you are taking pictures against a flat surface, this is going to have pictures from across different angles of your body. Because the purpose of this scan is to see things clearly, they may inject a special dye, either injection or orally consumed, so that it can have clear image production of either blood vessels or different organs. CT scan can be used for many different things, but I put 4 main categories that you can look into. First, you can study different diseases and health conditions such as tumors, bones, muscle disorders, and infections. And you can check if you have blood clot, internal bleedings, or injuries, especially when you can't see things with your eyes. If you have cancers or similar symptoms, it may be helpful to plan for either biopsies or surgeries. And last but not least, it can monitor the progress after a surgery. Continuing here from the previous slide, we usually use CT scan for lung and chest imaging or cancer, things like that. We do look for injuries for bones, but most often, bone injuries, if it's not so severe, you can take care of it with x-rays. But if it's something that you need more attention, you need to see the cross-section of it, you may use it with bone injuries. Because it only takes about 5 minutes, it's often used in emergency rooms. And 5 minutes means you have to actually stay inside of the machine for 5 minutes. So obviously you don't want something that takes too long, because if it's an emergency situation, you want to check if they have any internal bleedings or things like that. And because this is part of an x-ray system, it uses radiation, and it kind of looks like a donut shape. And you're going to go in there for a section of your body, and it's helpful to identify different injuries in your body. Another familiar test that you can use is MRI, magnetic resonance imaging, which uses magnets, obviously, and actually radio waves and a computer. So a patient would lie in a narrow bed, and it would slide into a giant magnetic tube. It's actually very loud, and it's kind of unpleasant. So nowadays, I think they give you little earplugs or something like that to wear it, and you have to stay in there for quite a bit. Similar to CT scans, you may have a special dye injected, and this is actually better for soft tissues. So when you have injuries or conditions for ligaments, tissue, different tendons, brain, and so forth. And especially brain, because it's a soft material, it's easier to see if you have tumors, aneurysms, or even nerve injuries. Unfortunately, it can take up to 30 minutes to produce an image. That means you have to lie down still for 30 minutes. Because it's very loud and takes a long time, you probably won't have children that are very young to have MRI unless it's very necessary. And you probably won't ask people who are with anxiety attacks or even claustrophobic to be inside for a long time either. And just to make it clear, because we're using magnets and radio waves, this one does not use radiation. So I have a picture of a brain on the left CT scan and on the right MRI. And as you can see, CT scan, it's picking up the bone structure very clearly, whereas the MRI is having more details on the brain. Another test is going to be the PET scan. Unlike the other two tests, this one is going to have the images using 3D colors. And as you can see on the picture on the right side, you have more than just black and white or gray. It's going to have yellow, blue, red, and so forth. In order to take the clear image, you'll have a small injection of radioactive substance into the veins, and it can monitor how body parts function. So on the right side that you see, they took pictures when you are at rest, and also when people are walking, seeing, hearing, and thinking and remembering. So they're having different activities, and based on that, you could see different parts of the brain being used. So the red part is the part that's being active. So they are going to be able to see and monitor if your body functions are working properly or maybe not working properly. Another picture of the same body parts with different imaging. So you have the CT scan and the PET scan of the lungs. And in the lungs, you can see the active cancer that is more noticeable on the PET scan. And with that, this lesson is concluded.